I think we're going to have to get a little bit more complicated and talk about how to actually change the plumbing of the healthcare delivery system. And the place we have to start is we have to understand that the fundamental goal is value. We've got to get good outcomes more efficiently. We can't get trapped in increasing volume or just trying to lower costs. Value is the fundamental goal that we have to use to redesign the delivery of care. To drive value, the fundamental way to do that is to improve the outcomes, to make quality better. Quality is the way to save money in healthcare, not to scrimp on services, not to beat down prices. These are some of the reasons that happens. In order to drive quality and to restructure delivery, there's really 5 or 6 fundamental strategic agendas facing every healthcare delivery organization, which you see here. Let me talk about each of those a little bit and try to give you a flavor for the fundamental restructuring that's necessary to actually change the delivery system, which is the only way to actually solve this problem. Number 1, we've got to reorient care from organizing around the doctor and the service, which is the way it is now, and having the patient struggle through this complicated process, which is not team-based, to a system where we organize around the medical condition of the patient. And we've got all the specialists necessary to deal with a patient's problem, in this case migraine care, in the same organization, working as a team, taking responsibility for the care over the whole cycle, not just for their little piece of the cycle. If we're going to achieve integrated care around the patient's needs, we need to have some volume. You can't have every provider trying to serve every possible patient. You need a certain volume of patients with each medical condition in order to do the job well. This is data from Sweden. You see that the typical Swedish hospital has 1 case per week of a given medical problem. There's no way without volume that you can organize care well. As David has said, we've got to start measuring outcomes, how well the patient actually does. But we've got to measure them comprehensively. We've started measuring processes, protocols, doctor's checklist, but that won't work. We ultimately have to measure how well the patients actually do. That's the only way to decide how value is achieved. To measure outcomes, we have to think comprehensively about what good outcomes are. It's not just survival, it's how healthy and functional the patient achieves. It's how much stress did we create in the delivery of care, and how sustainable is the health over time. We've got to measure quality over the whole cycle. You would be shocked to know that there's not a single provider in America that I know that can actually measure the cost of an individual patient's care over the whole cycle of care. Unless we can understand cost at that level of granularity, we'll never be able to make those value-increasing choices to deliver better care. David's also highlighted the need to shift reimbursement. The 3 boxes are the 3 common reimbursement models. All of them are fundamentally misaligned with driving value. We've got to start paying a total package price for the care for a patient's needs. We can't pay any more either for the individual services. But all of this is going to require that we move from the current model where we have a lot of separate standalone delivery facilities to really truly integrated care delivery networks. Let me show you one of those in just a second, where we've got, instead of standalone facilities, we've got a provider system, in this case Children's Hospital of Philadelphia, that has many locations serving the entire region, but they're all interconnected and coordinated so that the patient gets a careful integrated care process across all of these separate facilities convenient to their needs. As we try to integrate care, we have to start rationalizing so that every hospital doesn't do everything, every clinic doesn't do everything. We've got to get the right level of service in the right facility. There's no reason to go to a downtown teaching hospital for a service that doesn't require that level of sophistication. And then, of course, we've got to integrate across the facilities themselves. In order to really drive value, we've got to stop having mom and pop single hospitals that just serve one geographic area. We've got to start driving excellent providers across geography. You should be able to get Cleveland Clinic heart care anywhere you live, not just in Cleveland. These are some of the techniques that the leading providers are using to grow. And then finally, we need an IT backbone, which is going to be necessary to allow all of this to happen efficiently. We can't use IT just to automate what we do today, though. That will be a catastrophe. We've got to restructure the delivery process, but IT is a critical enabler. Everything I've said here is already happening. In some provider, in some country, in some facility, we just have to get on with really a strategic vision for doing this in the United States and other countries. And of course, we're just at the threshold of that. Thank you.